Hello and welcome. The number of positive cases for coronavirus is now almost touching 20,000 in India. About 640 people have died, while in many parts of the country it's flattening, if not lowering. It's still a big concern, particularly in cities like Mumbai, where I am presently, and many other states in the country as well. But one state which has seemingly overcome the challenge that coronavirus has thrown at it is the state of Goa. And Goa, as of the last few days, is reporting no positive cases. The last 7 cases that were in hospital have been cured and now gone home. So how has the state achieved this? What is it doing currently? What are the challenges it sees ahead, given that this is a state which receives a lot of influx from tourists and others coming in from other parts of the country and world? And what is this broad public health strategy that's going to be followed? To discuss that, I'm joined by Vishwajit P. Rane, the Health Minister for Goa, who also looks after industries, trade, women and child and skills. Mr. Rane, thank you very much for joining us.
Thank you so much, Govind.
So first question, tell us, I know that all the cases have been cured at the Goa Medical Hospital and everyone has gone home. So what are you doing presently?
Actually, what we are doing, is that basically initially when there was the cases slowly started rising in India, we immediately were one of the first states to go in for a sort of a lockdown, and we were insisting that there should not be a movement of people within the interstate. And also what we did at that point of time is we started putting our systems in place, taking all precautions and creating a tremendous amount of awareness campaigns among the people about coronavirus. Most importantly, putting up our labs in place, all protocols we needed to do, we started doing at that point of time. Actually, when we were zero itself, we started making the right type of noises, putting in the right type of training among our staff, creating capacity.
So what was that date when you feel you went into full-blown action, roughly?
Actually, our whole minute we detected, before we detected even once the first case in Goa, we started actually drawing up the protocols like I just mentioned to you. Minute we got the first case, we started, basically our whole system was so activated that we were doing all the basic tracking of the patient, from where he came, all these protocols. Our system was well equipped to basically trace the people. So all the 7 people, who we got positive, once we got these 7 people were the ones who came from the ship. And as I've always been saying, that I was worried of people coming in from the ship, because most of the ships were located at places such as Spain and Italy and other places which were infested with coronavirus. What we did as a policy, we did as a strategy is putting all the checking and random testing protocols in place. And what we started doing is started quarantining and doing whatever is the basic protocol that was there. But in addition, what we were doing is suspending all the OPDs. We started, trying to get the people, the foreigners, tourists who were there, trying to track who are in Goa, where are they located, and also random testing protocols were put in place. I think we must have been the first state to put random testing protocols in place to check people, even the foreigners who were there, so that we were in a better position to assess what is happening in the state of Goa. And simultaneously, interface between the people and the doctors, we were trying to reduce using new innovation and technologies such as CallDoc today, as you know, is being used by the Delhi government, teleconsultation. So we brought all these systems in place. We started reducing the human interface between the doctors and the citizens. Simultaneously, the protocols, we went on enhancing the protocols in terms of testing. I have always said that even if Goa is zero today, we are in a better position. We will actually know the position, because as you know that industrial activity has started. The more you go to test, and as you know, there are issues with rapid testing kits. But as you go and increase the spectrum of testing, which we are in the process of doing, as we speak, I have suggested to my secretary that we should get a machine. We should further strengthen the virology labs. We should increase testing setups in different district hospitals and in other places, so that, the testing, like, industrial workers, migrant workers, and people who need to be tested on a random basis, like I told you, the random testing protocol, which we have taken advice to put in place. This is helping us in today's time. And even now, as we speak, we have a big issue of seafarers coming into the state. So we are very well equipped to handle the situation at the moment.
Right. So I know that you're also setting up kiosks in different parts of Goa to where people can go and test. But what is the strategy of testing that you're following here on, now that part of the lockdown has been lifted and people, as you mentioned as well, are going back to work in the industrial estates?
We are actually asking the people and making testing, basically using at the moment, we are not doing the antibody testing because we are not a hotspot. But we have got certain places which are hotspots around us. We being it's a very big challenge for us because Goa is surrounded by Karnataka, Maharashtra and Kerala. Now what we are doing is kiosks we are making available at the borders, and we are making kiosks available at the industrial estates so that we have doctors there collecting the swabs from the patient, making collection also becoming very easy. And also, second thing is we are encouraging the industry to tie up with us. Also, if you go to see logically, people have been, it's been a lockdown. People have been at home. They're more than 14 days they've been at home. But even then, as a matter of great caution, and we have also the government under the Chief Minister has already completed his whole, so we have done this door-to-door survey. We have identified about 5,000 such people in the state of Goa. For a small state like Goa, that's a big number which is going to be tested for COVID-19. These are people having symptoms such as like pneumonia. Flu, and fever. So what we are doing is we are quietly doing our activity. We are quietly following the ICMR guidelines and parallelly talking to experts and drawing up our own protocol within the overall protocol of the country.
And what's the load currently or capacity of your hospitals, both private and public, in the state of Goa?
We have got sufficient number of private hospitals. We have got two large hospitals. One is the Manipal group of hospitals. Then another healthcare run by local doctors and top prominent doctors. We have got Victor Apollo, and then we have got our government capacities which are in place. At the moment, as we speak, we have got sufficient bed strength. The government medical college itself has got a sufficient bed strength. We have managed with that. We have got a dedicated COVID hospital. And we are now, since we are zero, we are now trying to build up the bed capacity, the facilities in the COVID hospital, because we have got time now to build up these capacities. At the moment, the government hospitals, and if you ask me in terms of a ventilator, luckily none of the patients needed the ventilator. And we were able to get them out and declaring them as negative as per the protocol that has been defined. But as far as the ventilators are concerned, we have close to about 100 ventilators within the setup. But we have already placed an order more than a month back for nearly about 200 ventilators. So we are also training our staff back end. We are giving online training to the nurses. So basically, we are preparing ourselves in case there's an eventuality or a situation in the future.
Right. So since you mentioned the 7 patients and they did not become serious. So all of them had basic symptoms like high fever and so on, and then they were cured? Or did anyone progress?
6 of them, I think, they came from the ship. 6 of them traveled from abroad. They came to Bombay. One of them came from US to Mumbai, Mumbai to Goa. Others also on the same route who came into the state of Goa. All were from the ships. And they all were on the sea cruise, on the sea liners and other things. So basically, once they came in, minute we checked them, because one of them got a call that one of his friends was he is COVID positive. So immediately he came to the hospital, and we were any case testing everybody at the airport and checking everybody's history. So we had to go backward and get them admitted. Minute we tested them, they came positive. So basically we had to go in for quarantine and other things, which is the normal protocol that we need to follow. But one of them who was infected was the brother of one of the boys who came from the ship. But none of them, they were in pretty good condition. They gave them the line of treatment. None of them had to go close to the ventilator at all.
Right. So now the lockdown lifts on the 3rd of May. Now, Goa is an unusual state in as much as people want to come into Goa and visit rather than go out, which is happening with other places, particularly with migrant labor. So how are you seeing May 3rd as a date?
No, I don't. As you both of us speak, we know that the cases in the country are rising. As we speak, if you go to the live COVID app, it's showing around close to 21,000 cases, and also the active cases are closing in on the confirmed cases. So basically, this is a situation of great concern. All of us, and for us, the inspiration has been the Prime Minister and his guidance from time to time through video conferencing, and also our Health Minister, Government of India. But as you mentioned, everybody has been showing interest of coming into Goa. Now that is good, but that is also, we don't want such a situation coming where people start coming in large numbers into the state of Goa. What I have suggested to the cabinet, to my Chief Minister, is that we should insist on everybody carrying a COVID negative certificate before they fly. But I don't see flying also starting so fast.
Sure.
According to a lot of people who are in conversation, I feel that though we say May 3rd is the lockdown is going to end, but with the rising cases, I think it's a matter of caution for all of us. We need to take precaution. Industry, as far as tourism is concerned, I don't see it reviving over the next 6-7 months. Because I don't think any of us, even if you give me a free ticket to say, come fly to Bombay or fly to Delhi, I don't think I want to fly to either place. Everybody is going to be at their place because everybody is very concerned because there's no cure for COVID-19 as we speak. And everybody is, tuned into the channels. What you watch every day is only about COVID-19, deaths of COVID-19. So there's fear in everybody's mind. I don't see tourism reviving. As a result, as you know, that industry is live and livelihood has been the slogan of the Honorable Prime Minister, that both need to be balanced. With this, we want to take maximum precautions. I know people want to come to us into the state of Goa, but we have got hotspots touching us, and we don't want to allow anybody into the state of Goa without having thorough checks done. Even we have asked for clarification from the Government of India whether we can use antibody tests at the borders, but they have said no, because ICMR doesn't believe that antibody tests should be used at the borders. But similarly, we want people coming into the state of Goa carrying the COVID negative certificate, and we want to be strict. We are a small state. We have got limited capacities. We have been doing well. We have been following protocols. But somewhere, if we open up, there is a possibility that this will be very difficult for us to handle.
Right. And as you look ahead, you're also handling additional portfolios of industry, women and child development, skills. How do things look beyond the public health crisis that you are obviously now completely consumed with and will be for some time? But how are you seeing the fortunes for Goa beyond that?
No, industry, as far as pharma and all is concerned, pharma has been, we have been stressing on pharma here because pharma, we have got the 4th largest exporter is Goa for pharmaceutical products. Apart from this, there's been a demand from the industry. So I think already the list has come from the Ministry of Home Affairs. So all the list is being followed to the T. So we are trying to see and facilitate as per the norms that is given by Government of India, and also facilitate to and ensure that there's a proper flow of freight and other things. Whatever guidelines have been given, we have tried to see that we follow those guidelines. Those are the industries need to start, because for us like Goa, we have got two issues. One, tourism is badly, we are totally dependent to a great extent on tourism. We were dependent to a great extent on mining. Mining is shut. Tourism affected. So there is tremendous shortfall in terms of revenue. And this is a major cause of concern. So we cannot allow industry as a hub to shake. Industry is now the only pillar of strength which need to be for this state government here in Goa to see that we are able to see that the industry runs smoothly, but same time following the guidelines as listed by the MHA. And even then there's going to be a drop in production, because production is not going to be full capacity. And It's also migrant labor from the state of Goa has gone to others. When they could travel, they have gone back. So there's a big question. And once the lockdown opens, what feeling I'm getting I may not be correct. I hope I'm not correct. But a lot of migrant labor, they're waiting to go home. They don't want to stay in Goa. I think everybody wants to go back to their hometown, because the coronavirus fear is so much in everybody that nobody, whether it's a construction worker, whether it's a road worker, all he wants, he doesn't want any help from the state government. All he wants is to go back to his home. So this is a matter of great concern. If they go, again, this will reduce capacities to a great extent.
Right. And last question. So, and you are, like other states and cities, dependent on migrant labor yourself?
Definitely. We are actually, they are a major portion for us here in the state of Goa. They've been helping in the industries, in production, and basically where you require, in a great, many of the industries where you have unskilled labor, such as packing and other industries, including multinational companies where they are being used. And also, for us in the tourism sector, for us also in our own hospitals, I find that there's a large chunk of these people, if they go away back to their home. I have interacted with a lot of people from that community, and they all say is, fine, you're looking after us at the moment, but all we want is to go home. And if they go home, then I don't think we'll be able to bring industry also back to that level and that capacity. It's going to be very difficult. It's a challenge, but we'll live up to the challenge. We'll try to see how we can best look after them and see the all the industrial small scale sector, medium scale sector, even the large scale sector, how the government could step in and, take care of this aspect, which is now in everybody's mind, is what is going to happen after the lockdown. It's not necessary that they're going to be here. And this is, if production further gets affected, then it's a big challenge to the state government.
Right. Mr. Rane, thank you so much. I wish you all the best. And I do hope things return to normal in the complete sense. And I do wish Goa remains COVID-free forever. Thank you so much.
Take care. Bye. Be safe.
Thank you. Thank you.